Good morning, good evening, good night. Welcome back to Lana's Little Things with me, Dr. Lana, specialist gerontologist, talking all things on living agelessly, bridging generational gaps, family caregiving, entrepreneurship, and so much more. I'm joined with Phoenix tonight. He's providing moral support for our topic for tonight, which is depression in older persons and how we can tell. Now, so we're going to dive in because, yes, this is such a huge topic, and I know we just passed Senior September and World Older Persons Day, 1st of October. So, welcome to all older persons. Hope we had a great month. We're gonna talk about something deep like depression. Like why? Well, because it's something that tends to be skirted around a lot. It's something that tends to be avoided a lot by both patients, persons, and doctors alike. So, and also it's something that gets misdiagnosed or mistaken for so many other things. And so we want to just put aside some of the confusion and understand some of the middle and muddled and muddy ground that it can be in navigating, trying to figure out, well, is this person depressed? Is my spouse depressed? Is my grand or my mom or my dad, is they depressed? Or is it something else? For sure, if you're an older person, are you depressed? Now, bear in mind that depression carries such a stigma with it. Mental health concerns in general carry a stigma still, sadly, and that prevents persons from seeking medical attention or from recognizing or acknowledging what they're feeling and then being able to say, yes, I'm depressed. Or going to the doctor to say, yes, I'm depressed because you feel as though you will be discriminated against, dismissed, not given the right treatment, or just not get any better. And then what would be the point of telling people all of this if they're just going to dismiss you? I mean, that goes for any one of us. Who wants to feel dismissed? We've all had that experience where we felt disregarded. Yes, you know, as doctors, we can we know how it feels sometimes to be on the other side, and yes, sadly, it is true. You Some patients do come away feeling as though they were not heard. Now, who wants that when they go for help to feel as though they were not heard? It doesn't bode well for persons to actually seek help if they feel as though they're going to be dismissed. So it's true. So, hey, we really do have to be mindful about depression and things like mental health concerns so that we can mitigate the risk, mitigate the sadness, the loneliness, the isolation, the feeling of helplessness that can come with it. And of course, the definite risk of suicide in older persons, which is on the rise, the risk of heart attacks, the risk of strokes, the risk of just feeling and being getting more frail because you just feel as though, well, what's the point? We don't want that. No one deserves that. So let's find some way of identifying the signs of depression that will be different in older persons from the general population, and then how what can be done. And from the other side of the fence, physicians who how can you what questions can you ask? Family members, how can you tell? Is this brain fog? Is this a heart attack? Is this coming from a stroke? Hmm. And also reduce the stigma and just bring, as I always say, bring compassion, understanding, and empathy to the table. And just lessen off with the judgment and the dismissing. Let's put that to one side, shall we? So let's talk about what depression is. Yes, it's huge. Yes, there's several different things, but let's do a general um, explanation. So depression, as we know, overview, we can say, is it is not just sadness. It is not just um, a feeling that you have. This is a general group of mood disorders, yes, characterized by sadness, as in lack of joy or happiness, but lack of interest in life, withdrawal, removal from the things that one would normally have done, feeling of helplessness. And that persists from anywhere from 2 weeks, but generally 6 weeks, up to as much as 6 months. So it can be something that is progressive and characterized by these definite mood. We won't say swings, we would say a definite mood that does not go away. Leaving a person to feel as though there's nothing that can be done about their present situation, no matter what they've tried to do. Okay, so that's kind of that. So why and how is it different in older persons? An older person is hardly ever going to come up to you as a family member or to you or to a physician and say, I'm depressed. Hardly ever, because again, there's so much stigma. And then there is the very real possibility that it will be misread, misunderstood, and misdiagnosed, therefore. So, but it's something that we all have to be mindful of because of the other conditions that come with it, the other concerns that come with it, the very real medical risk of high blood pressure, heart attack, stroke, worsening of dementia that come with it. Okay, so let's just say some of the typical things. And you look at this list and you think, well, how am I going to know? But they put them all together and they can form like little pieces of a puzzle. They can form and give you a bigger picture. So a person would come in and say, I've got all these different aches and pains. Because that's easier to comment on. You're likely to get more empathy from a doctor if you come and say, well, I've got pain. So they'll give you something for pain. But then that pain doesn't go away. And it's a pain that is different places. And no matter what investigations are done, there's nothing that really can be found or nothing that can identify the severity of it. So back pain, and yet all the investigations done show it's not that severe. Yes, there might be arthritis, but it isn't to that extent. And then there's so many different joints that might be involved. Person wakes up today and it's the shoulder, it's the neck, it's the back, it's the knees, it's the fingers. It just doesn't make it's not adding all the pictures. There's no trauma, there's no fall, there's no slip. There we go. Then we must start to move a little more slowly. You're not waking up like before. You're not getting up with any kind of purpose or zest. Or you want to eat? Nah, I'm done. I don't feel. The appetite is gone. It might just be more irritable than not talking, or it might just be confused and not answering your questions clearly. You yourself, the older person might say, well, I feel confused, or I just don't feel right in my head. It's something that we hear in the Caribbean a lot. You're not paying attention to what you're saying, feeling tired all the time, just not wanting to talk. Their best friend and wanting to talk to, they don't want to talk anymore, really. They don't want to go out where they met. They don't even want to go to the supermarket or a church or the post office, which is where most older people tend to want to go or tend to go after a certain age. Those are like the social hot spots. Don't want to do that anymore. Or feeling and saying over and over again, well, my days are over, or I'm in the room now for the end, or my time will soon come, or I don't, this is what happens as you get to this age. Those little things might seem like small, non specific complaints or concerns, but it actually could be a sign that the person is depressed. So have a look and think about those things. Is that happening to your older spouse, relative, friend, patient? Is that happening? Are they saying these things? And definitely, if they're saying, well, I feel as though I don't want to be here anymore, or making definite plans not to take their own life, definitely that is an emergency. You need to really pay attention. But more than not, the common signs are non specific. Now, then, what are some risk factors? Who is at risk? Let me say you look at many studies and you see females. You look at some other studies and see older males. But generally speaking, older females, but those who have definitely, let's say, in recent times, lost a spouse, lost a good friend, have had a major illness in their life, major loss of a physical part of their body, major illness. Let's say you were in good health before, older person was in good health before. Now they're being diagnosed with high blood pressure, diabetes, something really, really major. That would throw anybody off, much less someone who's lived a healthy life their whole life. And now they're told, well, this is your life from now on. That can throw anybody in a tailspin. Those who would have lost, as I said, lost recently, lost a close relative, spouse, dear friend, peers. You see your peers going, they're just dying, or in hospital, or ailing, or really significantly unwell. Those things make a person wonder, well, is it going to be me next? And then the brain just so powerfully gives you all kinds of thoughts and all kinds of feelings. If you're in a position where you can no longer drive, you can no longer go out on your own, you feel more frail, you're not able to do your computing like before. You're told, well, you can't go here unless you have an assistant with you. Someone has to come and help you sign something. You're not seeing as well. You're not hearing as well. All those little things create an increased dependence. Anyone who's been more independent and now has to be more and more dependent on other persons, think of it. Bring compassion to the table. You're going to feel dismissible. Is that a word? You're going to feel as though you are easily discarded, as though your life has no value. No one deserves to feel like that. But and it may not be true. They may actually person's actually wanting to help, but the older person feels as though they're a burden and others will be better off without me, or I have to depend on everyone else. I'm just a trouble. And you hear that a lot. That's a clue. That's a flag. This person might be depressed. And you want to ask these things. Yes, there's certain formally, and there's a lot of different scales, geriatric depression scale, there's other depression scales that one can use. But these are just little signs that you can put together and think, is this an issue? Is this a problem? What about the fear of death? Some people really are afraid to die. So ask them, are you afraid to die? And ask it in a non-judgmental way. Just ask it as a matter of course. Touch the person. Give them a sensation that you are valued. You are a resource. Your life matters to us. Matters to me. Yes, there are brain changes that can create depressive symptoms, but even so, that person is of a higher risk for depression. So let's say a person recently had a stroke, recently had a heart attack. Those things can create changes in the brain, changes of blood flow to the brain that will that can create an area where it changes their mood, changes the firing of the nerves, you can say, so that they're just not feeling right. We're not going to all the so those are ways you can identify. Yes, there are different treatment options. Yes, there's a role for improved nutrition, improved social services, improvement in family life. Help them to realize that they matter. Help them to find ways to be mentors, to go out. This is obviously after the doctor has assessed them. But in general, is it something preventable? Maybe not in total, but one of the things that we can do, all of us can do, is to let persons know you matter, your life matters. We hear you, we see you, you matter, what you say matters. Someone like that, even if they're feeling low in spirits, will have an idea, well, you know what? It matters to others that I'm still around, and so I want to be around in the best mental and physical health I can be. So, with that, again, we bring compassion to the table. So, from my heart to yours, I hope this was helpful and you can find a little, you can add the little puzzle pieces up and see, is this person in my life, is this person in my office depressed? Hmm, do I have to ask other questions? Do I have to draw them out a little bit with empathy? Let's all do that. Let's all come together. Let's bridge these gaps. Let's bring compassion to the table because we're all one and we're all in this together. From my heart to yours, well, Phoenix is sleeping, but you know, I'm just saying this because animals are just fantastic therapy, just by the way they really are. So if you're an animal person, you know how it feels. If you're feeling low in spirits, an animal, a pet, is just like the best medicine. So again, from my heart to yours, good morning, good evening, good night. That's Lana saying until we see each other again, and just bring compassion. Let's raise the topic. Let's improve the conversation. We'll talk later. Mwah.